Welcome to a bite-sized HIPAA Q&A video where we answer your questions about how HIPAA applies to your dental practice. We recently received the following question in our bite-sized HIPAA Q&A inbox. Hey Todd, I have a quick question regarding HIPAA. We send two-sided postcards through the mail as reminders for all of our hygiene appointments. The information is visible on both sides of the card. Does this violate HIPAA's privacy standards since it contains our practice information, the patient's name, address, as well as the appointment time? Well, thank you for your question. If you've been watching my videos for a while, I'm sure you've heard me say that just the fact an individual is a patient of your practice is protected health information. So if that's the case, it seems like sending out a postcard in the mail with your practice name and the patient name would be a violation. Let's see what the HIPAA law has to say about sending out appointment reminder postcards. Our first step is always to ask if the information transmitted is considered protected health information. Here the answer is clearly yes. As I said earlier, the patient's name, along with any details regarding an appointment or treatment, are indeed considered PHI, so HIPAA is applicable. Next, we need to figure out when HIPAA allows the disclosure. Remember, our basic rule is that you cannot disclose PHI without patient authorization unless there is a specific permitted disclosure rule that applies. The permitted disclosure that applies to this question is the rule for disclosures for treatment purposes. Any communication about an appointment, whether a reminder or a follow-up, is part of the patient's treatment, so you can make the disclosure without patient authorization. But the meat of this question is really about whether the form of communication is allowed. Let's look a little deeper at the law to see what it has to say about this. HIPAA does not explicitly prohibit using postcards for communicating PHI, but Section 164.306 does require providers to implement reasonable safeguards to protect PHI from unauthorized access, and 164.502b requires providers to only disclose the minimum necessary amount of PHI to accomplish the intended use. Additionally, 164.522b1 gives patients the right to request communication by alternative means to preserve confidentiality. To reasonably safeguard the individual's privacy and comply with minimum necessary requirements, you should take care to limit the amount of information disclosed on the postcard. For example, consider including only the patient's name, the provider's name, such as Dr. Smith, the date and time of appointment, and a phone number to confirm. Certainly do not include any information about the type of treatment. If a patient requests that you communicate with them in a confidential manner, then you must accommodate that request if it's reasonable. For example, HHS considers a request to receive mailings from a covered entity in a closed envelope rather than by a postcard to be a reasonable request that should be accommodated. To summarize, HIPAA allows providers to communicate with patients via postcards, but you must limit the information disclosed to the minimum necessary amount and accommodate any reasonable request to communicate more securely. If you have a HIPAA question related to the day-to-day operations of your dental practice, feel free to send it my way. My email address is todd@bitesizehipaa.com. That's 1 P and 2 A's. I can't promise I'll be able to get to every question submitted, but I'll do my best to find the most applicable ones to address in future Bite-Size HIPAA Q&As.